would guess there's a big percentage of people don't like to talk about it. And there's a big percentage of people that it happens suddenly, you never get a chance to talk about it.
Well, of course, we are from the age that things weren't talked about.
It's not part of, hey, what'd you have for supper last night?
You've got to know what to do, what you want done.
We have to talk about this. We should talk about it so that when and if this happens, you get the care that you want.
Well, we did talk when you were in the hospital.
Oh yeah, I guess
And you
so.
did make the decision. We've talked since then and before that a little bit.
What did I decide?
You decided that you didn't want any CPR and that you didn't want resuscitation.
I still think that.
It's very difficult for a family member to make that decision if there's been no discussion.
I interviewed a couple hundred patients and families about their experiences with serious illness, with terminal illness, with frailty and aging, and then also followed geriatricians, palliative care doctors, oncologists. The question is, as we face these issues, what are we fighting for? The usual stance is, let's give you that operation, let's give you that chemotherapy as that last-ditch effort towards the end of life, or treat every problem that comes along the way as if it's just another condition to be solved. But mortality isn't solvable that way. So instead you have to identify, well, what are people's priorities besides just survival? The questions that you can ask are ones like, what's your understanding of your condition? What are your fears and worries for the future? What are your goals if your health is worsening? What outcomes are unacceptable to you? And then you get a picture that emerges. Writing this, I had to include my own father and how we navigated his care. He was suffering from a brain tumor himself as a surgeon. So he chose surgery, to undergo surgery for his brain tumor. Then he chose radiation therapy. And then when that didn't work, the choice came around chemotherapy. And as it began to deprive him of the ability to be able to have some of that life he wanted, he actually chose to stop chemotherapy and go on to hospice. Now we think that means he's shortening his life, but the studies are beginning to come out showing, that in fact many times those toxic therapies, when it's done as a last-ditch effort, shorten people's lives. We certainly see that in case after case where people have not expressed their wishes. When we have that conversation, it's often too late. And then 70% of the time when we come to the end of our life, it's going to be someone else who has to help make the final decisions. That's why it's so important to have these conversations earlier when you start seeing illness come onto the scene.